I was detected and told I was positive, it was a complete surprise to me. AOC was my haven.
I just couldn't believe it. I just wanted to die. I wouldn't eat. I wouldn't do anything. I just stopped living.
It took me about, I guess, 3 weeks or so to kind of get myself together.
Well, when I first was diagnosed, I didn't believe it. I wanted them to take the test 5 times.
It devastated me physically, mentally, emotionally.
When I first found out, I thought, well, okay, when me having this, I'm not necessarily was gonna die, because I knew that there was treatment out there that was available, but I figured, okay, well, if I take this treatment, it's gonna wear down on my kidneys and liver here, on down the line. So when I'm 50 or 60, I'll probably be dead from this medication.
Initially, I was scared because of all the negativity that's put out there, so I thought I was going to die. Then I was angry. Now I was depressed. And I pretty much had to learn myself all over again.
Can we stop a second? I'm starting to get emotional already.
I'm currently the executive director and have been since March 2013. And I am basically responsible for everything that goes on here, although I don't actually do it. I have lots of great people working for me who do the good work that we do.
So I'm a registered dietitian. I meet with our clients here for their nutrition needs, anything from weight loss to diabetes management, pregnancy, weight gain, anything that they might need.
We better film fast because I'm so used to this.
They can choose fresh fruits, fresh vegetables, soups, grains, pastas, rices, proteins. I think it's better than a grocery store because, well, of course, it's free. And it's also set up to be an education tool for our clients.
We have 45 people currently on our staff. We've grown in the last year by 10 people, and we tend to grow even more this year, 2018.
We're in the Geisel Morris Dental Clinic. Tuesdays and Wednesdays are our busiest days. We see as many as 26, 27 patients a day. It's very busy. We restore patients' oral health care back into functions. Yeah, a lot of people do have anxiety. We manage it by just kind of being comforting and upfront. This is what we're gonna do. So this is the next step, and these are the steps that we're gonna do.
Are you here for testing?
Yeah.
Okay.
The biggest thing that has impacted me over the years that I've been here is the level that the staff will go to make sure a client's needs are met. If that means that they have to work on a Saturday, come here on a holiday, stay late until 8 or 9 to help a client, that speaks a lot. My biggest dream would be to live in a world where HIV is not a disease, it's not a virus. That would be my ultimate goal, that one day there is a cure. And it's fine, if I'm out of the job, then I'm out of the job.
It's been a wonderful journey. Because of it, I really know all aspects of our work. The nitty-gritty, all the detail of medication. I have I stand in some good shoes to have a really good feel for everything that we do.
At AIDS Outreach Center, one of our primary goals is to reach the youth who are most affected by HIV today. Young people of color are the most affected by HIV, so we are creating programs that are specifically meant to target that population.
HIV isn't relegated to just one zip code, 2 zip codes, or a few zip codes. It's all over the map. The reaction to a new diagnosis by an individual who has just received the result can vary from individual to individual. Some folks often seem to have expected it, but many times what we see are individuals that did not expect to receive an HIV diagnosis and are really traumatized by that.
AIDS Outreach Center is the only organization like it in Tarrant County and surrounding areas. 85% of the people that we serve, one-person household, live on less than $22,000 a year, which is hard.
I like to say that you can provide services for people with HIV, and you can find services for people with HIV in a lot of places, but here you find a level of care that isn't matched anywhere in the community.
I found AOC in the phone book and on my computer. I drove over here, was greeted with a smile, even though I was in tears. They introduced me to my counselor, Jesse, who was the first person on earth that I was able to communicate with about the disease that I have.
What I like to tell people that are newly diagnosed is that they're not a biohazard, they're not a second-class citizen to nothing, that they're still a human being, they're still, you know, everything about them that made them before they were positive is still in them and still who they are. I mean, living with HIV and AIDS doesn't change that at all.
AOC, Fort Worth, Texas, the people here was the best thing that can happen to my family and I. You have to treat people the way you want to be treated. I will recommend this to any person that have HIV and afraid to let anyone know that they have it.
I try to let them know that you have a big support team. You know, everyone, we work together. The client is first. And we just pretty much try to get them where they need to be in life.
You need someone in your life. You're not gonna make it by yourself. Not with this type of disease. It's hard.
And I could not have done this without the help of all of these angels under this roof. These people treat you as a normal human being. This is the way I'm finding my way through my own journey.